That's a good question. Um, Medicare Advantage is a good plan. They have lots of them in my area. We have over 97 in Southern California. And throughout the country, some areas have more, some have less, depending on the amount of population living there and the competitiveness. But there are some issues. When you have a Medicare Advantage, it is more of a HMO network plan. Can you get PPO? Yeah, sometimes, depends on where you live, depends on the companies. Even in California, there's only a few of them in our area with 97 different plans to choose from. And yet there's only a few PPOs that are available. PPO doesn't mean you get to go anywhere you want. It just means you have a little more freedom than you have on a HMO. When you have a HMO, you're restricted to that network. The contract with the insurance company is with the medical group, not the doctor. So if the medical group and the doctor are not contracted with certain hospitals, certain people, if you do not have that, you may not be able to go to the doctor you want to. If you live in an area with a large population, it can be restrictive because you have to stay oftentimes within your county or within your state. Now, if you're in a rural area, it can even be more difficult because the fact that those doctors may choose that they don't want to have a Medicare Advantage plan. They may only want to have Medicare or a Medicare supplement or Medicare Medigap program, as they're called. So with all that in mind, that's the pro and con to it. One other thing that's important to think of, if you've had family that has had any health issues, if they had cancer or kidney problems, some of the other issues that came up, with those where you have to be infused by a doctor, you receive an infusion for your kidneys, or you're getting chemotherapy, that reverts to basically the Plan B portion of Medicare, which means the Medicare Advantage plan only pays 80% of it. So if you have a chemo bill of $10,000 a month, that means they would pay $8,000, you'd pay $2,000. For some people, that's not a big deal, but for the others, it is. So those are things you want to review with your agent. Make sure he goes over it, because your agent works for you, not the insurance company. And he wants to make sure, or she, that they have the plan that fits your situation. The right doctors, the right hospitals, and the right Medicare plans, and it provides for the needs that you have. So take the time. They don't charge you for their services. They get paid by the insurance companies. They all get paid the same, so they're not partial to any insurance companies. Check with a local agent and get their help, and they will be there for you.